So now let's dig into the weeds on this a little bit about the difference between allopathic and natural medicine, holistic medicine, however you want to say that, because this is where they actually really differ. And so most allopathic medicine is worked on inhibition or symptom control, whereas functional medicine, natural medicine, wants to get to the root cause, or what is causing the inflammation, what has gone wrong. And we want to get down to that and start to change what is allowing the expression of those symptoms. Whereas allopathic medicine, if you got a headache, we just want to get to the point that we are getting rid of the symptoms. Oversimplification, because they do look for tumors and they do look for things that could be causing a problem like that. So they want to get to the root cause, but typically they don't do the things that actually start to change your biology, which is starting to look at the pillars of health. How are you sleeping? What's your nutrition like? How are you moving? Are you stressed out? Do you have a problem with, community? Meaning, are your friends and family supportive or do they drag you down? So that getting to those root causes absolutely is what we as functional medicine and holistic providers, that's what we want to get to. So, whatever the cause may be, this is where we have to have some hard conversations. Were you abused as a child? 30%, unfortunately, statistically, 30% of women have been sexually abused. Do we have problems with that? Do you need to go see a therapist for that? Um, Most of the stuff that comes in here, though, deals mostly with sleep, nutrition, movement, and stress. Once we start to see those things and dig down into what's causing these problems, what's allowing the body to remain in fight or flight, what's happening to you that we need to do some either reframing or whatever needs to happen so that you can start to deal with this and allow the body to rest, relax, repair. That's where we want to go with that. As we're looking at this, herbs and what we do with functional medicine and root cause medicine is we look at how do we support the body and give the body what it needs so that it can repair and it can do the things that it needs to do. How do we take those underlying imbalances and how do we balance them out? That's most important to us, because then if we see what's happened and we can get to what the trigger is, then we can teach you how to repair that and reverse that. Whereas, as I said just a moment ago, most of your allopathic medicine is purely based on let's suppress the symptoms, let the body accommodate to what's happening, and then hopefully it all just goes away. Another difference is the modes that we do use. If we're using supplements and herbs, those supplements and those herbs are actually gentle leaders and teachers. I know there's a push out there with Dr. Gundry's work to avoid things that have lectins and this, that, and the other. If your body is resilient and overall healthy, then you can actually eat those lectins, which are in plants that you need because you need the polyphenols and the bioflavonoids so that your immune system can regulate. And the herbs and the nutrition and that type of stuff is very gentle. And as long as we aren't using hepatotoxic types of herbs, which is possible, but not real plausible. But if you're using those things, then what we can do is help the body and gently guide the body and give it the support it needs so that it clears things out. Whereas if we are using pharmaceuticals, pharmaceuticals work, they're meant to be short term, and then you need to take that little springboard that it gives you and use herbs and lifestyle and things like that to actually keep those effects going. But allopathic medicine starts to be very hard on the kidneys. It starts to be very hard on the liver. It starts to be very hard on the gut. And those are things that you need. So you can take a short term little hit, but overall, then you have to go in and start to repair some of the things that those things have done. Especially if you're using like antibiotics a lot, that really changes the gut microbiome, which affects your ability to make short chain fatty acids, which affects your ability to make your hormones and make your neurotransmitters. It just starts to really, really throw things off. If you want to do an interesting experiment, go to the National Institutes of Health or PubMed and start to put in antibiotics and depression, antibiotics and anxiety, and start to look at how those things are closely correlated, especially repetitive use and exposure. In functional medicine and holistic medicine, we like to really concentrate on prevention. And this is where I use the analogy of your retirement. If you start to pay attention to your retirement early and you're putting money away and putting money away and putting money away, by the time you get there, you don't have to do a lot to get to the goal that you want to save. But if you wait until you're 60, 70, or 80, now all of a sudden, A, do you still have income that you can save? Or do you have a problem with, I got to start to save everything and do drastic things so that I can put money away so that when I quit working and I no longer have an income, I can maintain the lifestyle that I want? And so that's the power of prevention. We now know there are lots of long-term studies on the foods that we eat, the sodas that we drink, the alcohol that we consume, and we can blatantly say that, you know what, if you don't have those things, you will live a much better life. But we do enjoy them. So it's being able to enjoy them intelligently and not affecting your health. I really can't say much for soda. There's really nothing redeeming about soda. Soda causes so many problems. The the bubbly part, the effervescence. When you drink that carbonation, that goes into the gut, starts to form carbolic acid. Your body uses what is in the bloodstream first, called buffering capacity, to buffer out the acid. As it buffers out the acid, you have enough buffering capacity to do about 6 of the 8 ounces of soda. This is an oversimplification, but that last remaining 2 ounces, where does your body get the potassium, magnesium, calcium, phosphorus that it needs to buffer the rest of that out? It starts to pull it out of the teeth, starts to pull it out of the bones. And so this is why we see people who drink sodas chronically have rotten teeth. It's not necessarily just the sugar. And they have brittle bones. And these types of things have been shown in study after study after study to affect these things, yet we still consume them. I don't, but people still do. Something to think about as an alternative. LMNT just came out with, they're going to be in big box stores now. And so that is an electrolyte drink that actually helps you. I would probably stay away from the sparkle, but some people need that bubbly, fizzy stuff. If you want to roll the dice on that, that's up to you. Now, what about the flip side of that? Well, in Earth.com or on Earth.com, which is kind of, they release a lot of research, they've just started to see where artificial sweeteners are linked to cardiovascular disease, heart attack, and stroke. So artificial sweeteners, I have been saying for decades, are bad, and the research isn't out. We don't know. They're too novel to know how they affect the human body. We've had them long enough now that we know that it affects the brain, affects the heart, affects the cardiovascular system, affects the microbiome. They're bad. Now let's go to, what are you drinking? Let's say we're doing high fructose corn syrup. High fructose corn syrup, there's a great video on YouTube called Sugar the Bitter Truth by Robert Lustig, and it goes through the biochemistry of soda or fructose. Let's just say fructose, because then that includes juice, fruit juice, and sodas, and things sweetened with fructose. Goes through your body exactly like alcohol, causing 8 of the 12 things that chronic alcoholism causes. And so you really don't want to be consuming that. And so first thing that I have when people come into me and their lipids are off, their triglycerides are high, get them off the sodas, and you would be amazed at about 60 to 70% of the people start to straighten up right away just getting off of sodas. So it really does matter. These preventative things, if you're not hitting the bones for decades and demineralizing them for decades, when you get to your 60s, 70s, and 80s, your chances of breaking a hip are less. If you're going to the gym and you're working out and you maintain muscle mass, the longer you maintain that muscle mass, the bigger your bank account is for health. If you get cancer as you're older and you have muscle mass, people who have muscle mass and go through chemo and those things have a much higher survival rate and much less problems than those who go into that catetic phase and don't have muscle mass, because then they just catabolize themselves and pass. So prevention, which is a hard metric to give you, is something that we concentrate on and we look at. And we know, because we've seen enough people who do the things that we say in the lives that they live as compared to the people who don't, we know that there's a much different quality of life. The next thing that's a difference in your medical doctor, who is highly intelligent usually, they are very smart. They know lots of stuff about the body, especially in their specialty. That's the interesting thing. So you have your doctors who just deal with the bones, like your osteopaths, orthopedic surgeons. You have your endocrinologists who deal with your biochemistry. You have your pulmonologist that deals with your lungs. You have your hepatologist, your liver doctor. You have your heart doctor, blah, blah, blah. Everything is a specialty. They want to piecemeal it all out. So they don't look at you as a whole. They look at you as parts of a whole. But the body is a system that works together. And so your functional medicine doctor, people like myself, will look at you as a system. And we want to optimize all systems. Now, we do testing. If we see blood in your stool, we are going to refer you out for a colonoscopy. I don't deal with those types of cancers and problems like that. My job is to make sure that everything is working well on a foundational level and then to optimize your life, your health. Whereas if I refer you out, there's a problem that needs to be taken care of first, and then you come back and we start to work with what we have from there. That's the difference. Allopathic medicine looks at certain systems, and if there's a problem, then they can deal with a very acute or short-term problem. My job is to optimize everything afterwards so that you feel, perform, and do the best that you can do. Next, we're going to start to talk about your nutrition. And so doctors like me, functional medicine doctors, take a huge, huge interest in what you're eating, and then, hey, do you have constipation? Do you have diarrhea? If you have constipation and diarrhea, we have to fix that first. That's why we do a GI map, so we can look at how the body is doing, and then we can start to address those things from there. Now, we have several patients that have cancer and have all kinds of problems with constipation and diarrhea. And we work with them to get them as normal as they can be so that they can function as well as they can function. But when we start to talk about that nutrition, we don't worry. This is kind of tongue in cheek. We don't worry about the flavor of the food. We do, because if you're not going to eat it, you're not going to eat it. If it doesn't taste good, you're not going to eat it. The issue is we've been brainwashed for decades and generations that your McDonald's and your Wendy's and your Hardee's and your Taco Bell and your Subway, those are the things that taste good and this is what you want. You know what? I've been doing this long enough now that I can sit there and I can make an absolutely delicious meal at home for less money than it takes to go to any one of those places, especially now. And to really put a fine point on that, when we look at like Indian food, it doesn't take a long time to throw a bunch of herbs together, put them in a pot, let things marinate, throw it all in a skillet, let it all come together, and that food is absolutely flavorful and absolutely wonderful. I did some chicken tikka masala this weekend, and I have been enjoying it all weekend long. We put a little yogurt on that. You throw in some fresh cut purple onions. You have crunch, you have flavor, you have tang, you have a little bit of heat depending on how you want to actually spice it up. But when we look at nutrient dense foods, herbs and spices are number two. Organ meats are number one. Me getting people to eat organ meats, it's ridiculous. My 30 and 40 and 50-year olds, and we talk about eating organ meats, and still, ew, you're 50 years old. I'm pretty sure you've done things that you don't want to do, and you still get it done. But hey, if you don't want to eat organ meats, that's great. That's up to you. I am the type of person that says, hey, if I can actually make this taste pretty good and it's going to give me the nutrition that I need, I'm all about it. And I will use the path of least resistance. So I make pâtés out of liver and stuff like that. The kids, as long as I don't tell them what it is, they eat it up. And it's quite funny. And they've caught on that if I'm kind of giggling or laughing, they're eating something that they wouldn't normally eat. And they no longer ask me what it is. They're just like, I like it. I enjoy it. I'm going to eat it. And then they may ask me later or not. So, anyway, you know, part of getting healthy is eating the things that give you the most bang for the buck. And that prevention that it gives you is what gives you the resiliency that if you are out at a concert and you want to have a couple of rum and cokes, you can take the hit. Then you clean it up afterwards, and you know how to clean it up afterwards. And so it starts to look at the whole body. So if you're getting exercise and you're sleeping well, when you do the stupid stuff like have a couple of drinks, the other systems aren't so bogged down that they can't help your body do more and recover. And that's all part of looking at the whole system. Now, if you're APOE 3/4 or 4/4, we're probably going to have a big, long discussion about alcohol and how it is not advantageous at all for you to be drinking this stuff. So, as we look at that prevention, we start to looking at the body as a whole, and then we want to look at that nutrition with the polyphenol rich foods and the bioflavonoid rich foods, and your body actually extracting the things that it needs to run the immune system, to give you energy, to help the gut, to make the short chain fatty acids. All of that is interrelated, and food is a drug. Actually, I shouldn't say drug. Food is a medicine. And you're going to eat more food in your lifetime than you are anything else. You might as well make sure that that is building you up and not breaking you down. So food is very important, and you can have fun with food when you go to different places. Try different things. We're going to go teach in Austin this weekend. When we teach, we're going to go to the local places and we're going to see who does farm to table. And I'm probably going to have barbecue, which is going to have sugar in it, but I'm going to make sure that I'm eating lots of fiber with that so that I am not compounding negative effects. And that's part of learning everything that you got to do. Lastly, the difference between allopathic and holistic medicine is the way we kind of approach mental health. You know, do you need to see a therapist? Not that allopathic doctors, medical doctors don't send people to that. But then, you know, there are alternatives out there that you can use, that you can get into, that help you kind of shut down the id and the ego and allowing you to objectively look at these things. What kind of reframing can you do? How about meditation, managing your sleep so that you optimize brain health, so that you minimize anxiety and depression? Looking at nootropics and using nootropics to increase BDNF. I mean, there's so much to that, and you cannot separate that mental, emotional, spiritual component from the rest of the body. Because if you don't believe you will get well and you identify as the illness or whatever is affecting you, then you don't want that to go away, because that is your identity and you need to actually pay attention to that. There's a great book called The Body Keeps Score, and it's talking about traumas, whether it's physical, mental, emotional. It talks about those, and the body keeps score. How do you start to deal with those? So as I start to look at the differences between allopathic and herbal or holistic medicines, on the herbal medicine side, we have root cause medicine. We look at prevention. We look at wellness. We want to use things that have minimal side effects and boost the immune system. It's highly personalized it's not cookie cutter medicine at all. And we want to help your body heal, and then we want to slow the aging process and inflammation. Whereas conventional medicine is symptom focused. You have a headache, we knock it out. You have inflammation, we use an anti-inflammatory. Anti-inflammatories cause breakdown in the gut and causes ulcers, long-term use, those types of things. So we really want to pay attention to that. It's short-term care typically. The side effects can be very significant, causing issues and causing other things that you have to go to. Very standardized cookie cutter protocols. I can tell you when somebody comes into me with low back pain, if they're on medications, probably what they're on. I know what the doctors around here prescribe. I know what most of the little computer systems, they use their little algorithm and they give them the things that they want and need. I've seen it enough now in 30 years that I can tell you what it's going to be. And we want this is reactionary medicine. This holistic is preventative, giving you the power to do the things that you want to do so that you can take care of yourself. You want to have prevention, build in that resiliency, nourish the body for long-term health, well, health and wellness, and kind of foster that mind, body, spirit so that you know that you're taking care of everything that you can take care of. And then you just allow the body to do the rest. Thank you for taking this time to look into the health of you and your loved ones. This broadcast does not constitute a doctor-patient relationship. It is intended for educational and entertainment purposes only and is not a replacement or substitute for care. If you are having issues, please seek a qualified professional trained in functional medicine.
We would be happy to be of assistance with both in-person and virtual consultations. Thank you.